because all of this, they are closed for the sake of being seen to comply. But from the perspective of citizens engagement agencies, the NOA actually was worried, and we actually got this as a learning curve. The fake news became predominant, increasing disbelief among members of the public. And so we saw premature resumption of social life in large numbers. Such events as weddings, naming ceremonies, lavish burial ceremonies, chieftains taking ceremonies, lavish birthday celebrations became rampant. And this fake news is actually continuing, because in this era of infodemic, we are also seeing the challenge of how to go about addressing the challenge of vaccine hesitancy. Misinformation by some religious leaders also played a significant role. Access to face masks and the high cost of sanitizers, the unavailability of water for hand washing in far-flung communities also shaped responses to non-pharmaceutical prevention measures. Risk communication and the community engagement efforts across Nigeria, for which the National Orientation Agency played a real role at the community level, was key facilitating factor for the measure of compliance that was witnessed at the grassroots. I'm very happy to note the synergy between the NCDC, of course, the academic community, and all other stakeholders that are working in the area of data generation. Because definitely, as my brother there from the African side, from the EU was saying, you don't have to torture data, but I think in the context of Nigeria, we need to torture data. So that data speaks to us and tells us what we need. Thank you very much.
Thank you very much, sir. I think you were really to the point in terms of really talking about, you brought us to think really about the kind of information that went around at the beginning of the pandemic. You know, the stories about 5Gs, the stories about you know, whether or not COVID is real or not, and I think that's really at the heart of what we're doing here. And I think you also have talked about the information, the communication. How do we pass message? You know, diseases are spread not only by by the environment, but also by the way that we interact with each other. I think that is the real driver. And thank you very much for a very scientific presentation. Thank you. So we'll trade in both Jordan's also the Honorable Minister to adjust this program a little bit so that we hear his voice a bit later after we get a bit more meat of what we're here to do. So we would like to invite the co-PI, Dr. Kusanya, who's going to come and tell us about the project and give us an overview of this project. Thank you very much.
Good morning, ladies and gentlemen. Good morning, Honorable Minister of States for Education. I would like to stand on the existing protocol already established by the DG NCDC. My schedule this morning is to give an overview of the project that all of us are here for. The title of which is Understanding Facilitators and Barriers to the Compliance with Non-Pharmaceutical COVID-19 Preventive Measures in Nigeria. Sometime in early 2020, sometime in March, Nigeria diagnosed the first case of COVID-19. And thereafter, the government came with policies including a lockdown. And everybody had to stay at home, including researchers. But while staying at home, some of us felt that we could do something to contribute as researchers working in university to the health system and overall well-being of the country. And we devised a way to collect data online using Google Form. About the same time, so many other research teams, including those in NCDC, also adopted similar measures of collecting data remotely using available social media networks. And this eventually paid off. Later in the year, in December 2020, there was a call by AFD to use a non-traditional data sets already available to apply for this grant. So we got a team together from College of Medicine, University of Lagos, Department of Sociology, Faculty of Social Science, University of Lagos, and the NCDC, and applied with existing data for this project. And we know that out of about 22 applications, ours was successful, and we got a grant. Dr. Bashola Okusanya, I work for the College of Medicine, University of Lagos. This, the previous slide, please. Yeah. So in the course of December to January this year, a team of NCDC and College of Medicine, facilitated by our project consultant who is joining us online, Dr. Basia Benso of University of Leeds, came together to put up this proposal. And this proposal is funded by the Agence Française de Development and Expertise France. And we obviously have the support of the Federal Ministry of Health. And this is more or less the consortium that will be implementing and financing this project for the next 6 months. So what are the questions we want to use this project to address? We have said we should torture data. We'll be very gentle while torturing data so that we don't be like those who torture people around here. However, we want to assess what social, economic, and political factors influence knowledge and perceptions of COVID-19 among Nigerians, and how the knowledge and perception shape population behavior and response to the COVID-19 safety protocols. This is a very large encompassing research question, and therefore we decided that it's better we break it down a bit more granular such that we could attempt to provide specific answers that overall, when combined, could answer this overarching research question. Next slide. So we have 5 sub-questions with which we'll be using to address the title and the project. And the first are the social, economic, and political drivers of people's compliance with the federal government of Nigeria's stay-home policy. Because we used already available data, this had been captured in early 2020, and that's why you're still seeing stay-home policy. However, it's going to be extended to even the current ongoing government policies. And this is important because if you look around the world, there are so many factors that influence social behavior, including political affiliation, including faith-based organization lineage and association. And it's just not enough for us to make assumptions. The data will document what the data as factors that contribute to social, economic, and political drivers of compliance to the government's policies. Next slide. Also in Nigeria, we have different cadre of people based on financial income and what their earnings are. As part of this data, we're looking at how regularity of income, how volume of income could influence the response of people to COVID-19 protocols. For instance, we don't expect the response of those who earn daily income to be the response of those who earn salaries even when they are not at work at home. A typical example is the reality of privately owned primary and secondary schools who are challenging paying their staff salary because of the lockdown, the fact that children were at home for months last year. So we want to assess what financial realities of Nigerians influence their response to COVID-19 safety protocols as stipulated from time to time by the federal government of Nigeria. The third one. We want to know what places Nigerians are likely to visit, irrespective of COVID-19 government policies, including stay-home policy, and how such places can be better organized to reduce infection risk. This is very important because in future, we may have other infectious diseases of public health significance, and we need to have information taken away from what our experiences are with COVID-19 to inform decisions so that ahead of even when we have a national problem, we can easily know where to act and what safety measures to put in those places where people are likely to go. The next one. The first question is, what are the changes in public risk perception, risk behaviors through the phases, both first and second wave of the outbreak, and what this relationship has with risky behaviors and the trend of COVID-19 infection? So for this, we'll be using a combination of qualitative and quantitative data to actually provide answers to this question, to look whether the changes in behavior in the first wave, changes in behavior in the second wave, how it relates with the trend of infection nationally and in regions where we have data from, and how this can be used to influence decisions. And finally, we want to know how government's non-pharmaceutical initiatives, including the MPIs, including other initiatives, has affected public trust in government and people's compliance with safety protocols. While preparing for this work, we realized that there are publications in the Netherlands, for instance, that says the government response in that country has increased their trust in both the government and in science. So we want to find out exactly what has happened rather to us in Nigeria based on the government's initiatives, whether it's increased trust or otherwise. So what are the data sources we'll be using? As I said earlier, the call actually asks for non-traditional sources of data. And for the College of Medicine data sets, we have quantitative data collected using Google Form from April to May 2020. And we also have quantitative interview using in-depth interview, which was done by phone during the lockdown in May 2020. For the NCDC data set, we have the Audience Perception Survey on COVID-19, APSC, the Nigerian Pilot Coronavirus Communication Survey, NPCCS, and we will be adding information from the PEC survey data sets. All these data sets had ethics approval by the time they are being collected earlier last year. The one from the College of Medicine actually had ethics approval from the Ethics Research Committee of the Lagos State Teaching Hospital, Jarabaluf. The overarching theory for this project is one of the theories of health promotion science, which is the theory of reason action, which has the construct of attitude, subjective norms. With these two core constructs of theory of reason action actually influence behaviors. And we know that behaviors is the behavior will determine how compliant people are to the non-pharmaceutical interventions of the government, including hand washing, physical distancing, use of face masks, particularly when people are within 2 meters. And when people are compliant, we expect a risk reduction for COVID-19 and also for other infectious diseases. But when people are less or non-compliant, we expect a higher risk of infection. Next slide. So what are the deliverables? We are very happy and delighted at the number of stakeholders that are here this morning, which shows that there's already demand for our products, even though we are just starting projects. So our key deliverables are: one, to provide results through dissemination sessions to the government, federal government of Nigeria, including the Nigerian Governors Forum, to provide our findings to policy makers and other stakeholders, including the Presidential Steering Committee on COVID-19. We are going to present a final project report to the funders, and we hope and plan to disseminate our research findings through scientific publications and conference presentations. Thank you very much.
Thank you very much. Sanitizer before and after. Thank you very much, for taking us through this. I think it's quite clear, I hope it's quite clear to everyone who's present about where this work is going, what the value add is. And I'm not going to try to repeat everything he said, but I think it's really critical that we know that it was an unprecedented time, and the introduction of the first calls, non-pharmaceutical interventions and public health social measures, the evolution of thoughts and research and ideas was very rapid. So I think at this time we just need to maybe give the team another round of applause. For, first of all, coming up with the idea, and then secondly, actually winning the bid from being the 1% of the 1%. So congratulations. So I'd like to ask at this point one of the co-investigators who will come and talk us through the work plan. Professor Ehiogumbo is one of the key staff of the project. Just invite him to take us through the work plan. Thank you.
you, moderator. The Honorable Minister of State for Education permits me to stand on already established protocol. My name is Ehi Gumbo, and I'm one of the co-investigators on the project. The speaker who spoke before me has really laid out what is out for us to achieve. But let me start by referring to a philosophy that's really guided us as we thought through this project, and one in which we really would be walking along. Arthur Ashe frames and says, we really must start where we are. We must use what we have, and we try to do what we can. And that really is what we're trying to do in unpacking data and using it to inform us about all those objectives already outlined. Our work plan, simply, I will go through the key milestones that we intend achieving in the next while. We're starting today with the inception meeting, but a lot has happened prior to this in putting the protocol, identifying relevant stakeholders, engaging them in different ways, and indeed in extensive look at the literature, including coming up with reasonable theoretical frameworks. Through the inception meeting, which we would have done today, we'll spend the next while in lots of virtual contacts as whole teams. The College of Medicine, University of Lagos, and ourselves at NCDC, together with our international collaborators in the global projects, interacting on some of the issues emanating from the data. We'll be convening sometime in July to engage with the data in critical reflection. A lot of reflexivity is anticipated as we try to broach on the various important nuggets from the data. We then again reconvene in August in yet another data analysis camp that will bring in the expertise, having seen the data points, and ask questions around the various objectives, all 5 of them. Our intention is that between August and October, we would have spent some time distilling and synthesizing all of the rich information that is inherent in our data forms. We plan that we'll have a dissemination meeting, and sorry the screen has just blocked the data out there, but I think that's in mid-October, on the 14th of October, which would be the 5th milestone, as it were. And ultimately have a report discussed by the 22nd of October. So it's a lot of work cut out for us, and we're delighted, honorable ministers, as principals here, that we've all rolled up our sleeves and we are ready to embark on this activity. Again, thank you, and we're really pleased to have this interest in this work. Thank you.
So I want to use the opportunity to also, since we're talking risk communication and information, to do a public service announcement in terms of how to wash your hands, right? So, sanitizers, do that. So that's, and I'm just saying that because that is part of the kind of thing that this work should show us. It should teach us, like Prof has said, what are the unique bits of data that's out there, and how do we adapt it to our critical work, and how do we make decisions? I think from what they've said so far, something jumps at me that it's really about lives, about localities, about livelihoods, about liberty, and about the long term. So we hope that by the time the report comes out, the publications come out, that we will see how this information will be useful not only for this, for the response for the rest of COVID-19, but for other outbreaks in the future. We have on their stakeholders. Maybe we'll take one or two quick feedback from any of the stakeholders here. Please straight to the point again. We are running a little bit behind time. So maybe if I have show of hands from anybody who wants to respond or give an advice or a piece of commentary on what has been shared so far. And while I'm doing that, I'd like to recognize Dr. Chike Nwagu online, who was with the NOI polls, been part of generating the data sets, as well as Dr. Akinade, Director of Finance, the College of Medicine. So any thoughts or any comments from anyone? Okay, Shakir, anyone else? Any other? Okay, anyone online? If you want to make a comment online, you can either type it in the chat or raise your hand so that we can share. So Shakir, please go.
Okay, thank you very much. So we're very excited to see something like this happen. Right from the beginning of the outbreak, we have concentrated a lot on quantitative data, surveillance data, and the rest of that. And we know that when it comes to the response of people to public health policy, at the end of the day, social and economic factors that determine what people do. And in our response to polio and HIV, we have learned a lot in that regard. But one thing I would just want to say is that working with the NCDC from AFNet, we have supported residents and graduates to do a lot of research addressing some of these issues. So I want us to make sure that the residents are included, particularly in these data analysis camps. I think this is an opportunity for them to acquire extra experience that are going to help with the work, and it's an opportunity for them to learn how to use social epidemiology, beyond the usual quantitative things we've been doing. So I think it's very important for us to do this. You're going to get people that work for you, but are going to learn a lot that they can apply when they're triangulating, their quantitative data from the other studies, from surveillance and from the specific protocol-based studies that they've been carrying out. Thank you very much.
Thank you very much, Dr. Shakir. We have online Dr. Rex, but maybe before Dr. Rex speaks, I will take off my moderator hat and put on my hat as and introduce myself, because I haven't. My name is Dr. Emmanuel Agogo. I work for Resolve to Save Lives. And I just want to say that, part of the data sets that you've talked about, the PEC data, the Partnerships for Evidence-Based Response to COVID-19, the data was generated with approval from the NREC. And I've really looked at, across the 20 countries, including Nigeria, these kind of data sets, perceptions around COVID-19, movements, tracking movement with Google data, just like he said. And there's been a lot of innovation that we've seen across the world. I think it's a huge opportunity to triangulate all these data sets that are available and really understand our own the pandemic as it happened in Nigeria, and learn from it for the future, because it's critical that in the future, when we design messaging, when we engage with people, when NCDC or any of the stakeholders needs to engage, whether it's Lassa or any other epidemic that happens, that the messaging is right. I think that is one very critical thing that we hopefully that this work will deliver on. And on that note, I'll invite Dr. Rex from WHO, who's online, to say a few words. Over to you, Dr. Rex.
Thank you very much, and I stand on behalf of the WHO representative to pass our congratulations to the Honorable Minister of State for Education, and also the DGs present for NCDC and National Orientation Agency, as well as the Provost for the Lagos College of Medicine. This indeed is quite a landmark from our group, and I've listened to the many comments that have been made, that indeed we need to know more about COVID response, especially the social-cultural factors and the political economy issues. We need to build our evidence, as we have seen as we went through the response. WHO has many times changed the guidelines that are provided to countries on really understanding better of what has happened. And in Nigeria, as in fact stand out in the world on using evidence, and indeed in making quite a successful response so far. So we want to make sure that indeed that is built on with this research, which is quite a landmark, that we will know more, and therefore not only in COVID, but in other responses, we will be able to tailor more all these measures of non-pharmaceutical. So we look forward. I know the time frame presented is quite short. It's quite going to be a marathon for investigators, but we are looking forward here to that information, which not only will help us in this current COVID response, but indeed in other future pandemics. Thank you very much, and congratulations once again.
Thank you very much for the rest. Thank you. Interesting background. Okay, so at this stage, we would like to invite the Honorable Minister of State for Education. As you know, Honorable Chukwuemeka Nwajuba, I think we need to really celebrate his presence here. Honorable Minister, this is a health event. We have you in the center of the discussion. So welcome, sir.
That's done.
Thank you very much. And actually, thank you for allowing me the opportunity to still say good morning. I didn't know this program would run this fast, and I'm happy that each time I get into the company of technocrats, because this room sounds like that kind of room that they can call room of technocrats. I'm quite comfortable that you are able to almost execute flawlessly things that we as politicians find very hard to roll along with. So thank you to the two DGs here. My elder brother, the DG at NOA, who Dr. Barry has been, like the biggest support pillar for most of our political processes from our days pre-mergers of APC, and he has not way back, all the way from all that big desert of Yobe State. He is able to control everything happening in the country. That is massive. And then also to thank my dear colleague at the Presidential Steering Committee on COVID, which we started out as PTF, Dr. Yenkwaz. For many who do not know, before we even started the PTF, the president was, elated when he said, "You mean when WHO selected you to go to China?" He said, "Yes." The president was very proud. He said, "We have people." So we have this kind of cooperation. But more importantly is to see the cooperation that Dr. OK brings with what the University College at Lagos is doing. The College of Medicine, like all other colleges of medicine, are within the confines of our universities, but they're almost like independent programs. And we always encourage them to do this sort of collaboration from across the field. So I will always take advantage of the fact that we as politicians are the only people who are, we've gotten to the height where we will wait until all the big people who know book finish speaking, then we'll come and summarize as if we know anything we're talking about. So it's a given, because I'm going to steal the paper of Madam, the first paper. If you see the English in that thing, God bless you. Most of you need to appreciate that what it is that we're doing is to try to coordinate and use what this whole expertise to run the country. So for us, she said there are some people who are on the service side and the demand side. We are on both. In fact, we are both service and no, I'll tell you a story, because when I became Minister of State for Education, most of the people, governors started, some governors you think that were actually educated, I felt that when you say Minister of State for Education, what it means is that I'm the minister that is in charge of states. I said, the English is not correct, you need to adjust it. But see, there are things we do with data that becomes, that's why the premise of what we're doing here today is so important. Dr. Barry solved a $24 million problem without knowing it. I called him one day that the country is processing from the World Bank a $24 million facility to be able to enumerate schools in Nigeria. But that doctor, I have a small idea. He said, what is it? I said, I'm going to send you a WhatsApp of a template to ask questions. In this period, if we pretend that we want to give schools something, everybody will sign up. If we pass through governors, they will inflate the numbers. If we pass through teachers, they will inflate the number of students. What are we going to do? He said I should send him the template. I sent him. In every local government in Nigeria, NOA has an officer. And all he simply did was tell his state, I don't know what they call them, state directors. And the state directors told their local government directors. And they simply took the form. What was the form? Name of school, location, name of teacher, principal, telephone number, and how many students. You know, World Bank was going to give us $24 million to do this survey. We did it with about 3,500 naira. So that's the kind of thing data can do for you in a country. So today, when we came to PTF and they were trying to bamboozle me with how much work they know and how doctors react, I said, lie. We know the figures of schools we have. We have 25,000 places where we're going to take. They said, how do you know that? I said, I know. It's Dr. Barry. For a country with nearly 35,000 primary schools, out of which federal government owns only, the state government own about 5,000. State individuals own and institutions own the rest. If you decide that you want to shut down schools and you won't help nearly 1 million teachers who are going to be off lesson, what do you expect them to say when you ask them a COVID question? You say, come back, fire both here in the federal government. So for me, why do you investigate? We are going to be capturing this data. We missed. I feel that I still the boss Mustafa, who is the chairman of the PTF, and the rest of the Minister of State Health, Senator Mamora, and my elder brother, Dr. Henry, who is the Minister of Health, as well as the Ministers of Aviation, Foreign Affairs. We argue a lot at the PTF. Minister of Interior, we argue a lot. What is it? Let data inform us. We are running a country. The directives of data versus this sociological context in which you interpret data must always be a directive that must be thought about at all times. And this is the gravamen of what it is that this thing needs to do. When they said COVID partners had contributed 21 billion, the first impression at the time was that if you lock people down and they can't buy food and they can't do anything, why don't we distribute the money? I said I wanted to know how many poor people we actually have. This is our first test. I would rather the Ministry of Communications give us a 333 code to whom everybody will send help every week so that we can send them 3,000 naira, because big men will not apply. No people who apply, poor people. And immediately I will know how many people who are interested. But when we missed that opportunity for that data and took an alternative route, the Governors Forum, they have not recovered from that. So when you're going to be hearing from the citizens whether they trust the government, by the time we got to NSAS in October, they were now seeing where the COVID palliatives were passing. Fire this government. That was because we misjudged an aspect of the data. So when I heard and got this invitation, I saw a new opportunity. You're going to please help us. This is an opportunity that, yes, Oyibo people from France are funding, but they're going to be Nigerians operating this. So whatever data you're producing, we're going to be a demand side who actually use this data. We want to know the total population in Nigeria who didn't come in contact with this. Why? The tests we perform in Nigeria it's very misleading. Because only the few people who have been tested from the beginning are the ones being repeatedly tested. They've tested about 10 times. I'm tired of the testing, sir. So you can see 3 million tests, but you've applied them only to 300,000 people over the past 1 year. Because we do not have a national identification number to go with it. Why is that? Every other place, if you are testing in the US, they're asking for social. So, at what point do we then decide the integrity of this data if I'm determined to interrogate it? Because if you ask any woman, and this is not peculiar to women, the tendency is to hesitate around age. If you ask her, why are you asking me? So if it's a young girl that you ask, she wants to increase the age a little bit to show that she's also a part of what is going on. So, if you've missed a 17-year-old girl who claims she's 18, how is your data accurate when you're going to do the demographics of who does what and in what response? You've already missed that. So the foundation for the data are suspect. But I'm glad that we have this opportunity. And for the first time, I can't see a lot of politicians except behind me. So I'm just going to take caution from people like Professor Elias, because these people are no nonsense people. And run with it with the way we can, so that we can know that there is some level of accuracy that can make our decision making a little bit less flawed than it always has been. But I thank you for the opportunity to come. May I now avail it.
So, do you want to come to the middle? This feels like what they're doing.